There are a whole lot of people taking a whole lot of stuff that I'm a bit concerned about. The top 5 things that Dr. Dave would take. Next.
Top 5 with Dr. Dave.
Top five.
So, I've been asked multiple times by many people on social media what to do if they get COVID. Now, I will tell you, I obviously cannot answer that question for you because I'm not your doctor. I don't have your information. I don't have your case. So no duh. And it's also based on this principle you hear me say over and over again, and is one size does not fit all. It's an old adage that I think we all should heed. So I can't answer that for you, but I can answer it for myself. I can tell you what I would do personally, and is also keep your attorneys out of my DMs. Okay. So aside from quarantine, here goes. I would actually supplement with these things. The first one is vitamin D. We learned that vitamin D is an essential cofactor in the healthy regulation of about a third of your genes. It also plays a major role in regulating the immune system, but particularly the immune response to viral infections. Go figure. Experiments have shown this, and they show that vitamin D has a direct antiviral effect against certain viruses. It's also known that vitamin D deficiency actually confers more risk of influenza and respiratory infections. So you might be saying, well, how much, Dr. Dave? I've read your mind. Trust me, I get it. And it depends. Because I personally know what my own vitamin D level is, I can be smart about supplementing it. For me, I would take 2,000 to 3,000 international units per day. But don't you do that. You have to know what your vitamin D level is, and the only way to know that is to get a blood test. Why not just take a bunch, you might ask? Well, it's called Hypervitaminosis D. And I know it sounds like I just made that up, but I did not. And trust me, you don't want that. You don't want too much vitamin D. Confusion, muscle weakness, apathy, recurrent vomiting, abdominal pain. You urinate a lot. You get dehydrated because the vitamin D also increases your calcium to toxic levels. So you do not want the clinical symptoms of vitamin D toxicity. The second thing that I would do is low-dose aspirin. And one of the major concerns that we've been hearing about, and many of you have heard this as well, that COVID-19 has this tendency to form blood clots in different organs. We think that in medical science, we think that that's related to the damage that's done to the vessels by the inflammation of COVID-19. It's a big deal. It is not something trivial. Even patients who've had otherwise no other really significant symptoms have actually had strokes caused by the clots during the COVID-19 illness. So I want you to know this is a big deal. I would take a low-dose aspirin. What does that mean? For me, it would be somewhere between 81 milligrams and 162 milligrams. There's a rub, and here is the rub. If you've had a bleeding problem, if you have an allergy to aspirin, if you've got gastrointestinal or digestive problems, if you are pregnant, if you have an upcoming surgery or procedure, you should not just be willy-nilly taking aspirin. Guess what? One size doesn't fit all. And you can cause a whole lot of harm with a little simple aspirin. Trust me, you don't want to do that. Call your doctor. If you don't have one, this is the time to go hire a doctor. The third thing that I would do is zinc, believe it or not. We've been hearing a lot about zinc lately, but I want to hit some points. Increased intracellular zinc concentrations do efficiently impair the replication of RNA viruses. This is what I want. I want that. You want that. But don't let that little element fool you and think that it's completely benign. If you overdo zinc, you can cause a lot of problems. If you take too much zinc, you actually also may cause a problem with copper deficiency, which leads to a bunch of stuff, including your inability to fight infections, low white blood cells, anemia, neurologic problems, like I can't walk right, my balance is off, numbness and tingling. And unfortunately, some of the things can be irreversible. Trust me and believe, you don't want to do that. If I were going to take this, I would be super careful and only take it 3 times a week. And I would take a low dose with a supplement that also has copper in it. So somewhere between 15 milligrams and 30 milligrams is what I would do. Here is the note. The CDC or the COVID panel says that they don't recommend this. Not strongly. They don't recommend it at all as a supplement on a regular basis. The fourth thing that I would do, plant-based diet. Nutrient-rich, plant-based diet. I'm going to give you a whole lot more in the coming months about Dr. Dave's plant-based diet and what I want you to focus on. But for here, focus on the functional foods. And functional foods with antiviral properties are things like low glycemic index fruit, a variety of vegetables, olive oil, fish like salmon and tuna, and mackerel, nuts, beans, legumes, seeds, herbs, roots, fungi, like mushrooms, and get your fiber from the vegetables. I would avoid a lot of whole grains during this time. The fifth thing, probiotic, you got it, and probiotic like, fermented foods, kimchi, sauerkraut, yogurts, right? Although some of the yogurts that have probiotics in them are not, plant-based, they are natural sources of probiotics. Why? Well, the microbiome is the name that we give the good bacteria, billions and billions of bacteria that are already in your own digestive tract, that can get thrown off by infections and inflammation. And what I want to do is reconstitute that good microbiome, that good, healthy bacteria that's in the gut, so that I can help fight the infection long term and the long-term effects of COVID-19.
Top five, top five, top five.